Hi, everyone. Thank you for joining us. We are beginning the update today. I want to explain the interpretation options. Muy buenas tardes. Bienvenidos a la sesión informativa. Para escoger la interpretación en español durante este informe comunitario, pueden pulsar en el icono del globo que aparecerá en un momento abajo en su pantalla. Cuando pulsen este icono pueden escoger el idioma, que es español o Spanish. Si nos acompañan desde un teléfono celular, pulsen los tres puntitos, escojan interpretación y el idioma, y luego escojan salir. Así podrán escuchar esta llamada en español. Welcome, everybody, and thank you for joining us today. My name is Angela Cimental. I am the spokesperson for Boulder County Public Health. We're glad that you're here today, and we hope that this regular COVID-19 updates will give you an opportunity to hear more about the COVID response in Boulder County and ask questions that you may have. Today, you're going to hear from Lexi Nolan, Interim Executive Director of Boulder County Public Health, Chris Urbina, MD, for Boulder County Public Health. He's our medical officer. Trina Rowland, Boulder County Attorney, and Chris Campbell, Communicable Disease Emergency Manager for Boulder County Public Health. I just want to go over some quick housekeeping items before we get started. We will be taking questions at the end of the update using the Q&A feature at the bottom of your Zoom screen. So please type your questions there during the Q&A section. For those who are joining us over the phone, you can dial *9 to raise your hand, and we will call on you to ask your question. To unmute, you can use *6. Please keep your questions short so we can answer as many as possible today. Now I'm going to turn it over to Lexi, Executive Director of Boulder County Public Health.
Thank you, Angela. I'm attempting to share my screen here. Is that showing?
We can see it, yes.
Great, thank you. So good afternoon, everyone. Lexi Nolan, Deputy Director of Boulder County Public Health and Acting Executive Director. I'm going to provide a short update on general statistics.
Lexi, if you can expand your, we can see your background, just make it a full screen for your presentation.
How's that?
That looks great, thank you.
Okay, thank you. So these will look like familiar slides to you all. This is our overall level in the dial. You'll see that Boulder County continues to remain at yellow level at this point. Our current incidence level is 172.7, which puts us in yellow. That is up from 132 last week and 109 the week before. Our current positivity level is 5.3%, which is up from 4.2% last week and 3.6 the week before. So we are increasing in cases and positivity. Our hospitalizations remain the same at 11 days of decreasing or stable admissions. And if we take a little closer look at our cases over time, what you see is that, sorry about that, cases are, the 7-day moving average is increasing a little bit over the past few weeks. That is typical of what's happening across the Metro Denver range and more widely across Colorado and even the United States. And our average, we're seeing an average of 82 cases per day, which has been increasing since early March. If we look at the distribution of the cases, we see that the proportion among our municipalities is largely the same, but the numbers are increasing. And if we look a little bit more closely at the age breakout, what we see is that the 18 to 22-year-old age group is spiking somewhat. A significant number of those are students. We're also seeing increases, as you see in this graph, on the kids under 18 who, as we all know, are back in school now. This is not particularly unexpected. We knew that there was a trade-off between being in school and keeping our cases low. What we do want to do is keep an eye on these trends, though, because we are concerned, particularly as variants continue to spread, that we are keeping folks safe, particularly folks who tend to be impacted more. What's heartening about this graph is that we see that case rates for our older populations, which have significantly more vaccine, are remaining low. Those are our most vulnerable, medically vulnerable folks. And so keeping cases low in that age group is particularly important. If we look at the trends, we can see that the cases in the 0 to 4, 5 to 9, 10 to 14, and 15 to 17 age groups have increased significantly in just a week. We do encourage folks to continue to wear masks and to make sure that you're sending your children to school healthy and staying masked. And if we look at some of the racial breakdowns, we know that disparities have been a very big concern over time. And what we are seeing is, although our case rates are increasing recently, the disparities are not increasing at the same rate. So we're actually seeing fewer disparities among different populations, particularly Latinx population. And finally, we are happy to say that we have not had any deaths so far in April, and our last death was in early March. And with that, I will turn it over to Chris Campbell, who will provide some updates on vaccinations.
Thanks, everyone. I think we were going to go actually to Dr. Bina. Does that sound all right, Angela? Next, should we stay with that order?
That is correct. We can go with Dr. Urbina.
Okay.
Great. Great. Guy, Chris Urbina here. Can everyone hear me?
We can hear you, Dr. Urbina.
Thank you very much. All right, so a couple of things. I don't have slides to present. I do think that I wanted to just talk briefly about variants so that people can understand why this is so important, that what our director, Lexi Nolan, just talked about. As you know, you've heard a lot around the media, both nationally and locally, that we now have the P1 variant that's been first located in Brazil. Why that's important, and I think people would need to understand the importance of variants, is this. We all need to know that the virus is mutating constantly. Most of the mutations that happen are relatively innocuous or don't cause problems. There are 3 variants that are really variants of concern that we see in Colorado and across the country. Those are the B117, that's the UK variant. There's the South African variant. Again, it's not didn't occur, it's just first discovered in South Africa. That's the B1351. And then the California variant, which is the 1.427.429 virus. Each of these variants are concerned because of this, and this is important that people understand this, is that they can be more transmissible, they can cause more severe disease, they may not be as sensitive to treatment, or they may not be detectable by current diagnostic tests, or protected by the vaccine. So I think if you understand that, and I know I'm speaking a little slow, part of that is for the Spanish translation, but it's important that you understand that as the virus mutates, these variants can cause more severe disease and be more transmissible. The 3 variants of concern that are present in Boulder County, the B117, as well as the B1427 or the California variant, and now the new P1, all are likely to be more transmissible and may be causing more severe disease. With the P1 variant, this is a very big concern because now we think it may be less susceptible to both natural immunity, your own personal antibodies produced, or the vaccine. So we're watching this very closely. As we go forward, we're going to be looking more closely at the transmission of these variants, and we're likely to have a longer quarantine period for them. We're working very closely with the state health department to interview these cases of the P1 variant that is currently in Boulder County, so that we can stop the spread very quickly. The important thing to remember as we look forward and go forward with these variants is this. We believe that the vaccines are very effective against all the variants. So if there's anything that you do, you should strongly consider getting the vaccine. That's one. Two is that the same recommendations that we've been talking about forever in terms of using a mask, of doing physical distancing, of avoiding large gatherings, of washing your hands, are also highly effective against protecting against the variants. So that even though there are these variants that can cause of concern in our community, the same protection things that you are doing now that can be used to protect you against the variants. And it's also important to know that if you get vaccinated, there's no longer a reservoir for these vaccines to continue to spread to other people that are not vaccinated, as well as prevent the virus from continuing to replicate and possibly producing more mutations. So I know there are going to be lots of questions about this. So I'm going to stop there and turn it over back to Chris Campbell that'll talk about the vaccinations. But if there's anything that you need to do is get vaccinated and also do those prevention strategies that we've been talking about for a long period of time. So I'm going to stop there and turn it back over.
Thanks, everyone. I actually think we were going to turn this over to Trina next. Angela, do you want to go ahead and take that one? I'll wrap things up with the vaccine update.
Perfect. Yes, let's turn it over to Trina, who is Boulder County Attorney.
Thank you. I'm just going to give a quick update on masks. As you can see, I'm actually outside. Boulder County updated its mask order last Friday, April 2nd, to no longer require masks outdoors. However, masks are still recommended if you're outside. So prior, if you were outside and could not maintain social distancing, you were required to wear a mask. That's no longer the case. However, indoors, in indoor public spaces, masks are still required. There was a change in the state order as well last Friday, but that does not apply in Boulder County. If you are in a public indoor space, you still must wear a mask.
Thank you, Trina. Chris, now it's your turn if you want to go ahead and give your update. Thank you.
Well, of course. Hi, everyone. Let me go ahead and share my screen. Again, my name is Chris Campbell. I'm emergency manager with Boulder County Public Health and working with remarkable teams on our vaccine campaign in the county. So give me just a moment. Let me share my screen. Okay. All right. I just wanted to give an update on just a big picture view and also just a cause for. Hey, buddy, I'm giving a presentation. So
just
remember,
do some Mario Kart with Gigi.
Hold on just a sec.
If I close my.
No, I need you guys to go upstairs. Thank you. Sorry about that. Again, the joys, we're still all working at home. So I just wanted to give the community members and everyone just an update, the big picture view of how many vaccines have been administered in the United States. And it's definitely something to celebrate. About 170 million first dose vaccines. So simply remarkable and really something that truly needs to be celebrated. So just wanted to mention that. Give me just. All right. Sorry about that, everyone. So also want to mention and just give a bigger picture update as well on how many vaccines we've done in Boulder County. Again, something to really celebrate. So with that first dose, almost 130,000 vaccines that we've administered in the county. And what is interesting to look at and share with the community is that's about 46% of the adult population. Relative really to the state and to the country, they've certainly doing incredible work across the state. Community members with at least one dose is about 30%, and that full course, which is really good to look at as well. 70,000 people in Boulder County with that full course, and really exciting to celebrate. So it's about 25% of the adult population. Really in the rest of the country and the national average, it's about 19%. So it's just a testament again to community members making that really good informed decision to get vaccinated. And the work of our providers and all the partners out there that have been providing vaccine to community members. Wanted to let the community know about our goals with vaccine and how many we're administering per week and really per day. We really want to keep tracking this and making sure that our providers are prepared to give vaccines in the community. And so we've been doing about 24,500 vaccines per week, which is again something to celebrate. That is really up from some of the numbers we talked about. We're only getting allocated, 8,000 vaccines a week or 10,000 vaccines a week. So those numbers really have gone up. So we're excited again to be able to continue to provide vaccines to community members. And that leads us into some things we're projecting or some goals we're projecting. Just some thoughts with this slide and just to share with the community. Our goal is really to reach about 70% of the adult population and really get them vaccinated by the first or second week of May. That's certainly a lot of factors that could impact that. That does assume that we'll be getting a consistent first dose allocation. And if that doesn't happen, this timeline will be pushed out a little bit. But we just want to make sure that we're prepared and kind of understand, the vaccine and how it's going to really impact the community. So our goal is that date, and really through maybe even the end of summer, June, mid-June, we really hope to have the entire community vaccinated. So it's an ambitious goal and one we think we can meet. We'll continue to update community members on this as we track this, and we're pretty confident we're going to continue to receive that vaccine allocation. So we want to share that today. I know and we talked many times about our equity strategy and approaches. So we wanted to talk a little bit more about that. So we have the infrastructure built to really provide about 5,400 doses per week with really that lens of, and we talked many times in our community meetings around, we know community members have barriers to accessing vaccine for a number of reasons, systemic reasons. And so we have worked hard and continue to really focus as a public health agency on ensuring equitable access to vaccine. So we've made a lot of strides in this. We have several locations throughout the county now, and days throughout the week where folks that really are uncomfortable with accessing that traditional system that I've talked about many times. So these are, our incredible hospital partners, the pharmacies in the community. We have also in the region, the larger state-run clinics or community vaccination sites, which those are being called. Sometimes those are challenging to get to. They take transportation. So really, we have worked on this approach and this strategy at a grassroots level. Continue to work with community ambassadors and cultural brokers to really provide equitable access through these sites. So if you're a community member that have some of these barriers, language or transportation barriers, you're medically vulnerable or having access or having trouble getting an appointment, we would ask that you do call our call center, and we have staff available to work with you to access one of our equity clinics. And I really want to continue to thank our partners on this. We've worked with Boulder Community Health on some of these clinics, and incredible staff. Carmen Ramirez with the City of Longmont was on our meeting last couple weeks ago, and really just, again, a large group of community members really helping us ensure equitable access. And just to remind community members about our phasing, and as you all know, on April 2nd, you probably know that really all adults in 16 or older now are eligible to access the vaccine. We have made good progress in all these phases, and progress continues. I just want to remind the community members that one of the biggest reasons I wanted to share this slide is, again, just remind community members of a little bit of patience, particularly if you fall in phase 2. Our providers are, you saw the allocations we're getting, it's about 20,000 vaccines a week. So as I've mentioned before, we're going to see more and more appointments through our providers. So we encourage community members to continue, to connect with providers. If you work with a hospital on a regular basis, or you're a patient of a hospital, please continue to work with them to get vaccinated. I know pharmacies in the community are doing incredible work to get community members vaccinated. On our website, which I'll point out, please continue to look at those state vaccination sites. If it works for you and you're able to go to up to the ranch in Larimer County, for example, that's one place you might have luck getting a vaccine. Otherwise, again, we're going to continue to work really hard to get everyone vaccinated, and we encourage you to keep going to our website. If you have concerns or unable to access our website, please call our call center, and we'll help you look at options to access vaccines. And I know Angela will give a little more update on some of our websites. I just wanted to mention certainly our where locations for vaccines, that's been an area we're really focused on. And we think that the website is a little easier to see the available providers there. We have all the state community vaccination sites on that provider website. And we continue to try to look to improve that as much as possible. So we encourage you to go there. If you have feedback, please give it to us if information on there isn't clear, but we've worked really hard and gotten some pretty positive feedback from the community that it's a little clearer on the providers how to go to their websites and look up vaccine appointments. So thanks so much, and we'll be happy to answer questions from community members.
Thank you, Chris. So now we're going to go into the Q&A portion of the update. And I just want to remind everybody of some of the housekeeping rules. We will answer as many questions as time permits. So our presenters are approaching these topics from a place of respect, and we ask that you do so as well. If we believe that that is not the case, we may need to mute a participant if necessary. We will be using the Q&A feature at the bottom of your Zoom screen. So please type your questions there. For those who are on the phone, you can dial *9 to raise your hand, and we'll call you to ask your question. To unmute, you use *6. Please keep your questions short. And we will be focusing on the questions that you post today. And if you have other questions that do not get answered today, please send an email to healthinfo@bouldercounty.org. So let me start here with some of the questions. We have one. I think Dr. Rita touched on this one, but people want to know what is happening with the new variant P1.
Thank you for the question. And I knew there would be lots of questions about the variants. So let me just try to tackle that one first. And then as you ask more questions, I'll be happy to go more in depth. Right now, we have in Boulder County documented 3 types of variants. We have 42 of the B117. We have 22 of the B1427, 429. That's the California variant. The first one was the UK variant. And we have 2 of the P1 variants. These are important to know that even though those case numbers are low, though not every test that is being tested is actually genomic sequenced. So we actually don't know the exact number of variants because this is a very complicated process. And the state does most of the testing of the genomic variants. They test or screen about 1/3 of all the PCR tests that are taken. So we think likely that there are more variants out there. But it's important to know that the variants are here. And so as we talked about a little bit earlier, it's still, we believe that the vaccines are highly protective or effective against these variants. And the public health measures that we talked about before, masking, physical distancing, washing your hands, avoiding social gatherings, are all very important to continue to maintain. And as Trina alluded to earlier, we're still recommending you mask outdoors if you aren't able to keep that physical distancing. So it's still important to keep those public health measures in place, and specifically around the P1 variant. The state is now interviewing these folks that have been infected with this new variant and making sure that we can contain the spread of the variants by isolating and quarantining the folks that may have been contacting. Things that we've been trying to do all along. And if we can get people to, as Campbell has mentioned earlier, to get vaccinated, then I think we will decrease the amount of variants in our community. And finally, if you have any symptoms, or you've been in contact with people who have been infected, either with a variant or another, or the predominant strain of COVID-19 in our community, you should get tested, and stay home if you have any symptoms and you've been in contact with anybody who has COVID-19. So these are the things that we've consistently been saying. So hopefully people will follow those guidelines as we continue to move forward and try to control this pandemic.
Thank you, Dr. Urbina. Lexi, we have a question for you. It says here that that the positivity rate is increasing, and does it mean that we are not doing enough testing to give us an accurate sense of how much the virus is circulating in the community?
Right. So anytime that our positivity rate is above 5%, we like to double down on testing because it will give us a more accurate sense of what the real level is in the community. We do still have a number of testing sites open around Boulder County, and we really encourage folks to go ahead and get tested if you're feeling symptoms or if you think you've had an exposure that was critical. You know, it's all the more reason for us to really go and get vaccinated, get signed up for the vaccines as soon as we can, so that those increases in positivity will begin to come down.
Thank you, Lexi. We have another question for Dr. Urbina. It says here, how effective are the current vaccines in people fully inoculated at not spreading the virus and its variants to unvaccinated people? And is there evidence for that?
Great question. Thank you for asking that, because I think early on we didn't know, because the vaccine companies hadn't really tested people, both Pfizer, Moderna, and the Janssen vaccine. They were still in the early throes of doing their clinical trials. So we didn't know how effective the vaccine were in terms of preventing both symptomatic infection as well as asymptomatic infection. We did know that they were very good at reducing moderate to severe disease, hospitalizations, and death. Now, recently, there have been a couple studies published in the national media and also talked about in the national publications as well, showing that the vaccines are highly effective, not as high as 94 or 95% effective in Pfizer and Moderna, and in the case of the Janssen, 79%, but they're still very effective at reducing asymptomatic infections, so that if you do get vaccinated, and Campbell and our team have done a very good job of doing this, it's likely not only it will prevent severe disease, hospitalization, and death, and very likely strong evidence that it'll prevent symptomatic as well as asymptomatic infection and spread. And therefore, we can likely reduce our recommendations outdoors, although we're still going to recommend, because there are a lot of people that are not vaccinated, still continue to maintain physical distancing, wearing your mask coverings, avoiding large groups, and washing your hands. Those are still important prevention strategies.
Thank you, Dr. Urbina. We have two questions about easing restrictions, and Trina, these two questions might be for you. So one of the questions is, you know, with cases rising and variants coming, why are we easing up on the outdoor mask mandate? And then the other one is, can you help us understand why restrictions are being relaxed despite increases in positivity in case counts among younger people?
Sure. Thank you for the question. So the state mask order did relax indoor restrictions. That is not the case in Boulder County. So I just want to be very clear about that. In Boulder County, masks are still required in all indoor public spaces, regardless of your group size or vaccination status. With regards to the outdoor masking requirement, there's a couple of reasons for that. First of all, we are making this change in partnership with all of the metro region, so that all of the metro region will be aligned in requiring masks in public indoor spaces. Second of all, we've implemented this order for 30 days for the specific reason that we can continue to evaluate our case counts, our positivity, our hospitalizations, and the variants. And we're looking very closely at the data to make sure that we are appropriately moving away from restrictions. And third, perhaps most importantly, as Chris alluded to earlier, he didn't allude, he actually showed, 46% of eligible people in Boulder County have received the first dose of the vaccine. And we expect this to increase substantially. We also know that the risk of transmission outdoors is significantly less than the risk of transmission indoors. So if anything, we're asking folks to double down on their mask wearing indoors. And of course, we recommend wearing masks outdoors, but we are just no longer requiring it.
Thank you. Does anybody want to add anything for those two questions? Perfect. I'm going to answer one question that we received in Spanish. It says, you know, what can you tell us about any documentation or identification showing your medical insurance? La voy a contestar en español. La pregunta es, ¿qué puedes decir a la comunidad sobre cuando piden documentación, identificación y seguro médico? Me imagino que esto se refiere a las vacunas. La vacuna es gratuita. Y sí el proveedor médico puede cobrar un cargo administrativo de $23. No se requiere tener identificación, seguro médico y no es necesario el estatus migratorio para recibir la vacuna, pero sí sabemos que diferentes proveedores pueden solicitar información diferente, así que es preferible que la gente llame a su proveedor para saber qué tipo de documentación necesita, ya sea su nombre, su fecha de nacimiento para recibir la vacuna y la segunda dosis. Gracias. I'm going to go ahead and go into the other questions. So we have one here about the vaccine. It says, if someone who is not showing symptoms of COVID, but is positive when receiving their first or second shot, are there any side effects or health risks? And should they get tested before getting the vaccine? I think that's for you, Dr. Urbina.
Happy to answer that question. Thank you for asking that question. The first part of this question is, are there side effects associated with the vaccine if you currently have symptoms of COVID-19? If you have symptoms of COVID-19 or been exposed, you should probably delay your vaccine, because we obviously don't want to expose any of our workers or any other folks that are waiting in line to get their vaccine. So you have concerns about that, hold off on getting your vaccine. But however, there's no increased risk of side effects if you do happen to have an asymptomatic infection with COVID-19 if you get the vaccine at that same period of time. I would encourage you to wait at least several weeks after you have the COVID infection, but there's no side effects associated with getting your first or second dose of vaccine if you have ongoing COVID infection. Obviously, you will develop some natural immunity after you get the COVID infection, but if you get the vaccine after you developed, after you're out of isolation, after you're no longer contagious, then it actually boosts your immune system and actually be further protective if you get your vaccine after you've had the COVID infection. But you can expect the same level of side effects of having a sore arm, swelling, maybe feeling achy all over, fever, chills, those kinds of secondary side effects, but they're not going to be increased if you have simultaneous COVID infection.
Thank you, Dr. Urbina. We have a question that might be for Lexi. It says, if most of the high-risk population is vaccinated and hospitalizations and death are down, I don't know if that's completely correct. Does it matter if younger people are testing positive, and is it rare if it's rarely life-threatening to them? So I don't know if this is Lexi or Dr. Urbina, or both can weigh in.
I'm happy to start, and I'm happy for Chris to weigh in also. So it's true that hospitalizations continue to decrease, and we have not had any deaths since early March, and that's wonderful. The concern that we have, though, is a couple of things. One is that what we're seeing is that younger folks are being hospitalized increasingly, particularly in relation to exposure to the variants. And we don't have a strong sense of what the long-term effects of a COVID infection might be. We are increasingly getting information in the science in terms of lingering effects. We know that a third of folks infected and hospitalized with COVID still have symptoms, including neurological symptoms months afterwards. And so this question of the long-term impact is really important, particularly as we're seeing younger people be hospitalized, largely due to the variant. So it's a little bit of a race right now. We want to get folks vaccinated faster than we're seeing spread, and particularly because as we continue to have the virus in our community, it will continue to mutate, and we want to make sure that we can get it under control before a mutation that might not be as addressable through vaccination. Chris, do you want to add anything?
Yes, thank you. That's a great answer, Lexi. Just want to add one other thing. If you are still continuing to get infected and you haven't been vaccinated, you have an increased reservoir for the virus to continue to mutate and to spread to other people. So I think that eliminating that opportunity by staying home if you're sick, getting tested, isolating, and not coming in contact with people, and getting a vaccine, as Campbell has talked about earlier, will reduce the amount of mutations and reduce the likelihood that the infection will continue to spread. Very important that we pay attention to these strategies. And that's why I think when Trina alluded to earlier, we're going to be monitoring the data as we go forward, month to month. And if we see a rise in infections, then we will change our restrictions. But I think it's important that people pay attention to those public health strategies and go out and get your vaccination and get tested if you're sick.
Dr. Urbina, don't go. We have one question directed to you. So it says, CDPHE COVID data is showing that antibody test results are skyrocketing, going from the mid-20s almost of those have tested population being positive for antibodies. Can you please comment on why this is happening and the implications going forward?
This has to be a question for my friend Alec. Thanks, Alec, for the question. This is good news. That the antibody testing that's out there, I wasn't sure this would happen, but this is good news. This means to me that we have an increasing number of people that are vaccinated, and also people that have natural immunity out there. People are still getting antibody testing. So this is great news. It's some documentation that we're doing all the right things, Although I would prefer not to have people have a positive antibody test because they had infection. I would prefer that people have a positive antibody test because they've been vaccinated. So that's all good news, Alec, and thanks again for asking your question. And I'm glad to see you got your vaccination. Good work.
Thank you. Chris Campbell, I have two questions for you about providers. One is Good Day Pharmacy in Longmont a legit location for COVID vaccines? A lot of appointments, but it is not listed in the COVID-19 websites from Boulder County Public Health or CDPHE.
Yeah, thank you. And I did answer that one in the chat there, but it is, yeah, Good Day is a provider actually through the Federal Pharmacy Partnership. So they're located in Longmont, and I appreciate everyone pointing that out. We'll get them on our website, and definitely encourage folks to access vaccine through that provider.
We have another question for you, Chris. Do you know if Boulder County Public Health if Boulder County is notified when other people are vaccinated in other states or other counties?
Yeah, another good question. So all the data we show really is it's linked to an address or zip code. It's all through the systems that track vaccines. So no matter where someone gets a vaccine, we know a lot of Boulder County community members are probably accessing vaccine in other counties. Likewise, there's community members from other counties accessing vaccine in Boulder County. So the data we show and share is based on Boulder County residents. So we do know, yes, when someone else is vaccinated, either in another county, another state, and that's included in our data.
Thank you, Chris. We have another question about variants. It says, I think this would be for you, Dr. Urbina, can you break down the 3 variants of concern in Boulder County, and how do these variants affect the community differently?
Thank you for the question. I kind of alluded to that earlier, that we have a certain number of variants in our community, and you can go to the state website to confirm this because this is changing rapidly. We have 42 of the B117, that's the UK variant. We have 22 of the B1427, 429, that's the California variant. And of the P1 variant, that's the Brazil variant, we have 2 of those. Now, that's a small portion of those variants that we believe that are in our community. So, because the virus, regardless of whether or not it's a predominant strain or a variant, it's still spread the same way. What we're concerned about is these new variants may be more transmissible, last longer in our system. They may cause more severe disease. And so those are the concerns. That's why they're called variants of concern, is that because we don't know fully enough about them, we're still recommending people use those protection strategies that we've talked about. Wearing a mask, physical distancing, avoiding large crowds, and washing your hands protect you against the predominant strain or the variants. And we still know, and we're confident because many of the drug companies, the pharma, both Moderna and Pfizer and Janssen, have tested their vaccines against these variants. Although the effectiveness is slightly less, it's still very effective at getting the protection that we hope that people get when they get the vaccine. So in terms of how it impacts us, doing those prevention strategies and getting the vaccine will protect us.
Thank you, Dr. Urbina. I want to remind everyone to keep your questions short so we can answer as many as we can. Trina, I have questions for you. It talks about if there's any concern about CU mass gatherings with a lot of people being on mask outdoors and are relaxing the policy of the mask mandate outdoors. Do you think this will encourage more large outdoor gatherings?
We're not encouraging outdoor large gatherings, that is for certain. And once again, I think the answer to this is we're going to look closely at the data. We have not seen supermassive gatherings that I'm aware of, at least in the last week or two. Also, there's a consideration here that we want to encourage gatherings outdoors if you're going to have them, rather than indoors. Currently, there is a cap on outdoor gatherings of 175 people, and you have to have social distancing. So that is in place. We are looking at those restrictions and reviewing them now, and there will probably be some more updates next week.
Thank you, Trina. We received kudos here, and I want to pass it on to everybody. It says, thank you, Boulder County Public Health, for this update. Your great website and wonderful job you are doing with vaccination rollout. So I just want to pass that on to everybody. And then we have another question about the population under 16. What is the percentage of the population under 16 in Boulder County? And if we get 100% vaccination of adults, what is the percentage left of unvaccinated people? I don't know if Lexi or Trina or who can answer that question.
I can take that one in fact, I actually do not have a number for the community members today. I do know, and I know there's another question around particularly the 12 to 16-year-old or 12 to 15-year-old group of community members or younger adults. I know that is currently under, we're looking at, or it's being explored to make vaccine available to that group. It hasn't been approved yet. But I will say that we're keeping an eye on that, and we will start the conversations with school districts and early childhood providers to ensure to work on getting community members or younger adults vaccinated that fall within those groups. So we know that is coming in the future here, and want to make sure we're prepared. So just want to mention that to the community. I don't have the numbers today about the numbers that fall that are 16 and below. But we can certainly provide that the next update.
Chris, thank you. Can you mention, we have a few questions about providers and eligibility, but can you talk about vaccine supply, eligibility, and vaccine appointments and providers? Give us some general information about that.
Yeah, sure. And thank you, Angela. So we, again, I think I mentioned this in my presentation, but again, we're seeing a good supply of again 20 to 24,000 vaccines a week in the county, which is up significantly from when we started talking with you all early in getting vaccines out to the community. So again, that's very positive. I did think I saw in the chat there's someone that was trying to access vaccine in Longmont and saw some appointments available in Will County. I think one thing we're seeing is, just community members in Boulder are really making informed decisions and good decisions to get vaccinated. As you see from the numbers, we've had just a lot of community members wanting to get vaccinated, and so our appointments get full right away. And you might see a little less appointments available in other counties. So. Again, it's a message of patience for community members and continue to try to access vaccine. We work very closely with our partners in other counties. So if there's appointments available and you're able to go access those, please do. The important thing is, as the state and as counties, is we just want to work as hard as we can to get all community members vaccinated. And I know there was one other question in chat. Why I have had the moment. There's a question about vaccine hesitancy and our strategies for addressing that. We've talked about that in past meetings. That's a key strategy for our vaccine equity approaches. We have held several town halls just providing information. And for Dr. Bina's given town halls. Lisbeth Mendoza has given town halls in Spanish. So our goal continues to be, one, doing town halls for community members, and second, we also have informational packets. Our cultural brokers and community ambassadors have access to this information that we look to get out. We're going to look to get out widely, even starting as early as next week. to community members. So just lots of good information out there. We, and Dr. Bean has touched on this before. Seek out trusted sources like our website with public health and to really make that good informed decision about the vaccines.
Thank you, Chris. We're nearing the end of our community update, but we do have a few more questions. Trina, this might be for you. It says, given the outdoor mask requirement is no longer in place, will there be any other restrictions on, we are showing a page here. Are there any restrictions on personal gathering size, especially for any outdoors? Will that change at all, or indoors?
Yes, thank you for the question. Personal social gatherings are pursuant to CDC guidance, and I saw there was a question about that issue. Previously, it had been a hard line of groups of 10 and no more than 2 households. The state adjusted its order to match the CDC guidance, which just says small gatherings, which I think is fair to say should be no more than one or 2 other households with you. And the CDC guidance also strongly encourages all social gatherings to be outside. With respect to what this is going to look like going forward, we're currently evaluating the situation and looking at what might be appropriate. I think the biggest takeaway is that it is okay to gather under the order, but you should keep your gatherings small and you should be outside. And if you are inside, you should wear your mask. And I don't know if Dr. Urbina wants to add anything to this. And then I'll also just add, stay tuned next week because there will probably be some more specific guidelines coming out from Boulder County Public Health and possibly the state as well.
Thank you, Trina. This virus does not discriminate. It does not discriminate age. But if you're vaccinated, then you're going to get significant protection. Now, obviously, this is a risk benefit, risk reward benefit ratio. If you're outside and close to people that are unvaccinated, we recommend that you wear a mask. You physical distancing and avoid large gatherings. It's that straightforward. And we obviously are trying to control the virus as much as we can. When you see the national agenda currently happening in other states, our governor is about to reduce or did reduce the restrictions. So we're encouraging people to take precautions and use their best judgment to do that because this virus is spread respiratorily. You can protect yourself. It's that straightforward.
Thank you, Dr. Urbina. I want to thank everybody for joining us today. I want to just ask Lexi if she has any closing comments for the community update today.
I just want to say thanks to everyone, and we're going to be watching the numbers very carefully over the next few weeks to make sure that the recommendations and the public health orders that we have in place match the data and the science that continues to come in. We are very hopeful that the continued increase in distribution of vaccinations is going to play a really important role for us in being able to normalize, but we do want to keep an eye on the variants. And please do protect your kids. It helps all of us keep everything open as much as it can be right now and take us into the summer. And please continue to get tested. That's really important for us in controlling this virus.
Thank you, Lexi. We want to thank everybody for joining us today. As you know, our community updates are now bi-weekly, so our next community update will be on April 21st. We want to keep you updated, and if you go to our webpage, bouldercountycovid.org, and visit our social media pages, you will get daily updates there. If you have any additional questions, please send them again to healthinfo@bouldercounty.org. Again, thank you, everybody, and thank you to all the panelists for joining us today.